This episode was pre-recorded as part of a live continuing education webinar. On-demand CEUs are still available for this presentation through All CEUs. Register at allceus.com/counselor toolbox. I'd like to welcome everybody today to our presentation, Assessment, Identifying the Problem. Over the next hour, we're going to define screening and assessment, which you probably already know, but we're going to hit it. Define the purpose of assessment and explore the steps in a good, comprehensive, transactional assessment. And that's one of the keys that we're going to focus on today. We'll explain some of the steps of an ideal assessment, identify possible screens and evaluations that could be used in alcohol and drug or mental health settings. I'm not going to ask you on the quiz about particular screening instruments. I just want you to know that there are multiple instruments out there that you can access online for free, pretty easy. We'll learn about some do's and don'ts of assessment for co-occurring disorders, learn about or review the stages of change, and learn about the first steps in moving a client toward happiness. So screening is a very quick process which can be done by physicians, coaches, specialists and techs, counselors, pretty much anybody. A screening is basically going, do you have any of these symptoms, or do you think you have any of these symptoms? And if so, if you have a certain number, then we need to refer you to a licensed professional to be evaluated. Now, physicians theoretically can do the assessment, but that's not where their focus is. They're going to refer out to mental health providers most of the time. So screening is something that we really want to encourage in the co-occurring philosophy. We really want to look at helping people in multiple settings learn how to do screening. So anywhere someone enters the system, they can get screened and maybe get referred for mental health or substance abuse treatment. So in where people go to get their EBT or food stamps, where people go for any of the social services offices, and in the jails, obviously medical centers and places like that. Any place you can think of that a person may go who may need a screening is typically a good place to do it. One place I would really love